Hey guys, Dr. Prasoon here. India is under complete lockdown now. If you have symptoms like fever, cough, cold, sore throat, and diarrhea, then you might be thinking that it could be coronavirus. It is completely normal considering the current situation that we are in, but you should realize that it could also be just a common cold or a fever which is not due to coronavirus. And because of the lockdown, you will find it very difficult to visit a hospital and consult a doctor. So in this video, I am going to tell you all the medicines that you can buy and keep in your home and how to treat the mild symptoms that you have, which are similar to those caused by the coronavirus infection. All the medicines that I am going to tell you in this video are available in your local pharmacy and medical shop without any doctor's prescription because all these medicines are labeled as over-the-counter medicines. This is Do4D online doctor consultation. So let's get started. First of all, I would like to tell you that all the medicines that I'm going to tell you in this video are strictly for adults and they are not pediatric doses. First, if you have a fever and it is a mild fever, then you can take paracetamol. Paracetamol comes in 500 and 650 milligrams. Thing is that you should be taking paracetamol at least 3 times a day. The popular brands are Dolo, Medamol, Fepanyl, etc. Along with paracetamol, if you are getting adequate bed rest, make sure that you are not moving about inside your home. Drink plenty of water and the fever, it will usually come down by itself just with this paracetamol alone. If you have a cold, if you have runny nose, nasal congestion, or if you have rhinitis or allergic rhinitis, anything like that, then you can take cetirizine. Cetirizine is a second generation antihistamine and cetirizine can easily and effectively control your nasal congestion, runny nose, stuffiness, all those cold-like symptoms. Cetirizine comes in a dosage of 10 milligram, but you have to take it at bedtime only, at night time, because there will be a slight sedation associated with it. If you take it in the morning or daytime, you might feel sleepy. If you have cough, you can buy cough syrups. There are 2 types of cough syrups. I already made a video on this topic. You can find the link to that video in the description box and also in the I button. If you have dry cough syrup, you can take Ascoril D. If you have wet cough, you can take Ascoril S. 1 or 2 teaspoons every 2 or 3 times a day can be taken to control your cough. Another question which most of the persons normally have is regarding the use of antibiotics. The thing to understand is that antibiotics are effective only against infections which are caused by bacteria. Antibiotics have no evident role in controlling viral infections. So I will recommend you not to take any antibiotics unless it is prescribed by a doctor. Now if you have a sore throat, if you have soreness, if you feel dryness in your throat, then the best thing to do is to drink lots of water, preferably warm water. You can also try gargling with warm saline water, and many studies have also shown that 1 teaspoon of honey when taken at bedtime is very effective in controlling soreness of the throat and also controlling cough to an extent. If you have diarrhea, then you should be aiming at preventing dehydration, and for that you should be drinking more fluids, drink more home available fluids, buy oral rehydration solution. It comes in packets, it is a powder, mix it in potable water and then take it. Drink as much oral rehydration solution as possible because it is considered as a wonder drug and it can prevent and correct your dehydration and diarrhea. Now, even after taking all these medicines at home, and if your symptoms is not getting relieved, or if you feel that your symptoms are getting worsened, then you should definitely consult a doctor, visit your hospital. If you are a person who belongs to high risk group, in that case also, if your symptoms is not getting relieved after 2 or 3 days, then you should definitely consult a doctor. Now, who are the persons who belong to a high risk group? Those who are above the age of 65, those who have other coexisting medical conditions such as diabetes, high blood pressure, heart diseases, lung diseases, liver diseases, pregnant women, those persons whose immunity is compromised. For example, those persons who are undergoing chemotherapy, radiotherapy for cancer, those persons who are taking steroid for a long time. Steroids works by decreasing your immunity. So in those cases, all these persons are considered under high risk group, and if your symptoms are not getting relieved, then you should definitely consult a doctor. We must understand that even if you have all these symptoms, might not be a coronavirus infection. And even if it is a coronavirus infection, 98 times of 100, you are going to be normal. You are going to be relieved by taking these medicines alone. So there is no need to panic, there is no need to be stressed out. This is the first time that we are facing a virus which has infected close to 1 million persons and killed more than 25,000 persons. And by staying in our own homes, we are trying to break the chain and prevent the transmission of the disease. So I hope you like this video. If you have any doubts, you can contact me using the DoFoodie app. You can also contact me on WhatsApp. The number is 8100771199. If you like this video, consider subscribing to our channel. I will talk to you guys in the next one. It is me, Dr. Prasoon, signing off. Take care, stay healthy, stay in your homes, and thank you so much for watching.